Welcome to the TOEFL Listening section. In this part, you will hear one or more conversations in an academic or campus context, such as a discussion between a student and a professor or between two students. You may take notes while listening. Listen to part of a conversation. You will hear it only once, so listen carefully. After the conversation, you will answer questions about what you heard. Some questions will ask you about main ideas and details. Others will ask about implied meaning, speaker attitude, or how ideas relate to one another. Use both what is stated and what is implied to answer.
Good afternoon, Dr. Park. Thank you for meeting with me during office hours.
Good afternoon, Marcus. Please have a seat. What would you like to discuss about screen time effects on development?
I am preparing my literature review for the pediatrics seminar, and I want to focus on how digital device use affects cognitive growth in children. I have questions about mechanisms, outcomes, and practical guidance.
That is a timely topic. Tell me which age range you want to emphasize, infancy, preschool, or school age.
I want to concentrate on early childhood, from birth to 5 years, because that period involves rapid synaptic pruning and executive function maturation.
Good choice. Early life is when neural circuits are most plastic and when environmental inputs can shape attention and language pathways.
Can we start with mechanisms? How does screen exposure alter cognitive development at the neural level?
There are several mechanisms. One is displacement. The idea is that time spent on screens replaces time that would be used for language, rich interactions, and free play. Both are essential for vocabulary growth and executive control.
So displacement reduces opportunities for practice of language and self-regulation. Is there evidence for that?
Yes, observational studies show that toddlers with higher passive screen exposure tend to have smaller expressive vocabularies by age 2. Also, neuroimaging studies link excessive screen time to altered functional connectivity in prefrontal networks involved in attention.
You mentioned functional connectivity. Can you explain that term in plain language?
Functional connectivity refers to how different brain regions coordinate activity. When networks that support attention and working memory are less coordinated, children may show poorer concentration and shorter attention spans.
What about overstimulation from content? Fast-paced apps are very common for young children.
Fast-paced editing and reward-based games can condition rapid shifts in attention. That makes it harder later for children to sustain focus on slower-paced tasks like listening to a story or solving a puzzle.
Is that related to changes in attention regulation or to sensory processing?
Both attention regulation is a top-down process that involves the prefrontal cortex, and sensory processing is bottom-up. Fast-paced media can reinforce bottom-up orienting responses, leading to more impulsive attention and less top-down control.
Are sleep effects part of the cognitive picture?
Absolutely. Evening screen use increases sleep latency and reduces sleep duration, partly due to blue light and partly due to arousal from content. Reduced sleep impairs memory consolidation and executive function, which are crucial for learning.
Could you give me a concrete case or a study example to include in my review?
I can tell you about a clinic case I encountered. A 2-year-old named Noah had 2 hours of passive video per day and limited interactive play. He showed delayed expressive vocabulary and problems with joint attention. After a 3-month intervention that reduced screen time and increased caregiver-child shared book reading, his vocabulary improved significantly.
That is helpful. Does content quality matter for outcomes?
Yes, content quality and caregiver mediation matter a lot. Educational programs designed for toddlers and co-viewing with parents can mitigate negative effects. The American Academy of Pediatrics recommends guided interaction rather than solitary viewing for young children.
How about interactive touchscreen apps versus passive video? Are they better?
Interactive apps can be beneficial if they promote contingent responses and scaffold learning. But many apps marketed as educational lack pedagogical structure and instead reward random tapping, which does not support deep learning.
You mentioned contingent responses. Can you give an example of that in media?
An app that names objects when the child points and then waits for the child to repeat and responds to that repetition is contingent. It mimics the back and forth of caregiver-child interaction, which supports language acquisition.
What about socioemotional development? Does screen time influence that domain?
It can preschoolers learn emotion regulation from caregivers through joint attention and reciprocal play. Excessive solitary screen time reduces opportunities for practicing turn-taking and reading facial cues, which can slow socioemotional skills.
Are there dose-response recommendations I need to cite for policy implications?
Current guidelines suggest no screen time for children under 18 months except video chatting. For children aged 18 to 24 months. If caregivers choose digital media, it should be high quality and co-viewed. For ages 2 to 5, limit to 1 hour a day of high quality programming with active caregiver mediation.
How strong is the causal evidence that screens cause developmental delays rather than being correlated with other risk factors?
Most evidence is observational, so confounding is a concern. Families with less resources may also have more screen exposure. However, randomized controlled trials of media reduction interventions show improvements in language and attention, which supports a causal interpretation.
What about measurement challenges in research? What should I note in my methods section?
Measurement often relies on parent report, which can be biased. Use objective measures when possible, like device usage logs and actigraphy for sleep. Also assess content type and caregiver engagement, not just duration.
If I propose an intervention study, what outcomes would be most informative?
Primary outcomes could be expressive vocabulary measures and standardized attention tests. Secondary outcomes could include sleep quality, actigraphy data, and observational measures of parent-child interaction.
Do brain imaging outcomes add value for a small-scale study?
Imaging, like functional MR, can be informative, but is expensive and difficult with young children who can tolerate the scanner. For small studies, behavioral measures may be more practical and directly relevant to pediatrics practice.
What practical advice should pediatricians give parents based on current evidence?
Advise limiting screen time according to age guidelines. Encourage co-viewing and interactive activities. Promote alternative play that supports motor and language development and counsel about bedtime screen hygiene to protect sleep.
Is there any promising new direction in research I should highlight?
Yes, longitudinal studies that combine detailed usage logs, neurodevelopmental assessments, and ecological momentary assessment of caregiver-child interactions are promising. They can help disentangle timing dose and content effects on developmental trajectories.
Thank you. This gives me a clear outline for my literature review and potential interventions to test.
You are welcome, Marcus. If you draft your methods, I can review them and suggest measures that align with pediatric practice.
I will do that. I may also include the NOAA case as an illustrative clinical example.
That would be useful. It shows how reducing screen time and increasing caregiver mediation can produce measurable gains. Good luck with your review.
Listen again to part of the conversation, then answer the question.
Fast-paced editing and reward-based games can condition rapid shifts in attention. That makes it harder later for children to sustain focus on slower-paced tasks like listening to a story or solving a puzzle.
This concludes the conversation portion. For more TOEFL practice tests and study materials, visit Spinta.org.